recently, the governments of this country take a view on drug and alcohol, particularly around drugs. I mean, let's say in my career, we've got the end of Thatcher and we've got the Blair government, Brown government, etc. And certain kind of social problems arose. So drug-related crime became a big moral panic in the 90s. And money, the first drug strategy comes out. The first drug strategy actually was under the Conservatives, and it was called Tackling Drugs to Build a Better Britain. I mean, I think first time I saw it, I thought it was Taking Drugs to Build a Better Britain. But anyway, those strategies turned into a kind of attack on drug-related crime. So instead of it being a health issue, and Jerry Stimson got very exercised and angry about this, he said, basically the government are taking this away from health and they're putting it into the domain of crime, and that harm reduction really is about reducing crime as opposed to reducing health harms. And so things like that get driven. So, there was a very successful drive in one sense to put everybody onto opioid substitution treatment. There was, in the 90s, huge numbers of people got quickly onto prescriptions of methadone usually, and it did reduce crime. I mean, kind of people were satisfied with that. The drug-related crime went down. It had been inflated and distorted in various ways that Alex Stevens has explained, but nevertheless it was effective. But it didn't really do anything to help anybody, because it produced this next problem that people were on this quite powerful sedative drug and weren't really offered any kind of pathways out of it, and family members would complain, look, my addicted son's been sat on the couch on methadone for 10 years and nothing's happening. And all of this is a slight caricature, but it was a real issue. And as you know, it came to light when the BBC did a thing about people being parked on methadone